Welcome and good afternoon to welcome to the National Initiative for Asthma Reimbursement. This is the third year we'll be presenting on the request for proposals. We're going to just wait. It looks like people are still joining the webinar. We're going to wait about a minute or two here before we officially start. In the meantime, I will make the announcement. If anyone is having difficulties or joining or with audio or anything like that, please contact Annie Summers. That's asummers@ghhi.org, and we'll get started here in about 2 minutes. Okay, thank you. All right. Well, good afternoon. This is Brendan Brown with the Green and Healthy Homes Initiative. Thank you for attending the National Initiative for Asthma Reimbursement Request for Proposals webinar. Today, we will be doing some introductions by Ruth Ann Norton, our CEO and President. She'll be giving an overview of the Green and Healthy Homes Initiative. She'll be followed by Tracy Mitchell from the EPA Indoor Environments Division. And then we will also give an overview of the Business Development Technical Assistance Services, as well as the Reimbursement Support Technical Assistance Services. And we will be joined today by two of our business development sites, San Antonio Metro Health District, Tara Hausler, as well as Will Klein, representing the Contra Costa County project. And then from our year 2 reimbursement support sites, we'll have Joan Eichner from UPMC Health Plan, as well as Kate Belsey from John R. Oshide Children's Hospital. And so, and then at the end, we'll save a little bit of time to answer any questions or answers. So feel free to add those to the chat box. We will be monitoring those and try to address those at the end. Okay, and on that note, I'd like to introduce Ruth Ann Norton, our President and CEO. Ruth Ann.
Hi, thank you so much, Brendan, and thank everybody for joining. I have spent a week going to the states of Rhode Island and Michigan and talking about how we advance the social determinants of health, and this brings it right back to what we are trying to do in terms of merging this opportunity of healthcare and its role in advancing social determinants and health opportunities, and the quality and health of housing and the indoor environment. So I want to thank the Environmental Protection Agency, and most especially our friend and partner Tracy Mitchell, for the support to be doing this work and building a cohort of practice and action as we move forward, and to our 4 partners joining us as examples, as well as the interest here in moving this forward. So I've been, if you go to the next slide, Brendan, I think I will give you a quick overview of who we are and our team, and then get down to the real dialogue of why we're here, which is our request for proposals on this work. I think that I'm always very proud to represent and serve the staff of GHHI. It's one of the most well-qualified teams in terms of thinking analytically of moving this mission forward of the intersection of health, healthcare, and housing. Brendan is leading this project for us, and he works in our Policy and Innovation Division, which is led by Michael McKnight. You see the rest of the team here that is working on this effort, as well as this team works with healthcare entities across the country, doing everything from economic analysis and actuarial analysis to policy change for healthcare systems, managed care, hospitals, and state Medicaid programs. And I think today you'll find Will Klein doing a little bit of double duty between his analyst position and representing one of our partners from the West Coast. And I want to thank Annie for her support in this as well today. But a great team. I encourage you, if you have questions, reach out to any of us. But a team that is charged with giving ideal support to helping to solve the issues and goals that you have in engaging in this process. If you want to go to the next slide. A little bit about GHHI and sort of our history. We were founded in 1986 by 9 parents, to whom I see still as who we ultimately almost report to every day. It was their vision as their children were in the intensive care unit at Hopkins, suffering from the ill effects and toxic legacy of lead in Baltimore. They turned their vision outward and set out a charge for us to break the link between unhealthy housing, unhealthy children, and unhealthy families. We have taken that charge through the past 3 decades, looking at ways that we can advance not only the work here in Baltimore by improving the home environments around environmental threats and toxins, but how do we look at systems across the nation to build the right resources that the vision of health-based housing interventions, standards, policies are all able to be funded and from the right pockets, are all able to advance. So a lot of our work is in policy work of how do we change standards and practices and enforcement, but it's also how do we get the right money coming from the right places that align in mission. So as healthcare has moved more from volume to value, has moved more to support the health opportunities of advancing social determinants, we've really concentrated our efforts of where do we create savings by creating better environments, and what are the opportunities to mutually reach those goals. So we have a broad range of work from our direct service program in Baltimore to the over 60 plus cities and counties and 30 states that we've helped over the past couple of decades. And so our policy work and our direct service kind of support ranges from cities, counties, health institutions, state governments to the federal government. And we have a feedback loop of that work in our day. Every day I look at GHHI as a bicycle. Our the driving wheel has been our work in Baltimore to teach us every day and to interact directly as an organization with families and organizations endeavoring on this work. And the other wheel is how do we advance that nationally. You want to go to the next slide? So this is our concept about the way we work and the platform where we use housing as a platform for health, economic, and social outcomes is in how do we better align resources, how do we expand the pool of resources without taking it away, but better align dollars in their use, whether it be from philanthropy for core support around human capital or data or policy analysis, government around intervention, around big picture work like we're doing here. And then is there a role for the private sector, ranging everything from the quasi-private sector of Medicaid managed care to health institutions, to high net worth individuals, and corporate support, and how do we weave that together appropriately to advance a more comprehensive look at housing. So we base our work on a comprehensive health and housing assessment that looks strongly at the health of individuals and taking their care from clinics into the home, and how do we interact with that and address the threats that housing pose to the opportunities that housing can create for better stability, for better school and work attendance, for wealth retention. And we look at that as a platform of aligning, grading, and coordinating activities. And we've moved this forward to over 35 cities who have met criteria to be designated as GHHI learning and advancement sites, as well as some of the big state work that we're doing. And Brendan, you want to go to the next slide? So this is a good snapshot of where we're doing that health and housing intersection. We've got 20 current projects going on around the country, and then on top of that, what's not on this map, with all of these great institutions that you see here, is work that we do, for example, to advise the Energy Efficiency for All group in 13 states, where the element of health and those investments are being looked at. But we're really quite grateful to EPA and Robert Wood Johnson, the Episcopal Health Foundation, JPP, the states of New York, Connecticut, and others who have really moved quickly. And when I say quickly, over the past 5 years, which is quickly, to change culture and approach. And that's what each of you are looking to advance. And our role is to support that with the best capacity and tools to get you where you need to go on this. So I think I'm going to go to the next slide by turning this over to Tracy. So Tracy, let me hand this off to you, and our team will be here to answer questions about the actual RFP and the work, and look forward to that discussion.
Great. Thanks so much, Ruth Ann. So good afternoon, everyone. On behalf of the Environmental Protection Agency, my name is Tracy Mitchell. I'm a respiratory therapist and a certified asthma educator, and I've had the pleasure and privilege to work with GHHI for the last couple of years on this project, and we're entering our third year of the 3-year agreement. So this is how we're kicking it off, and I appreciate the opportunity to share with you for just a few minutes what EPA is doing to protect public health and to promote the collaboration and partnerships around reimbursement for preventative asthma control strategies. So thank you all for being here today. Next slide. So EPA's mission overall is to protect human health and the environment, and we do this through a variety of mechanisms. Most of you probably think of EPA and regulatory measures around clean air and clean water. EPA also conducts research, and we work through voluntary programs, developing guidance, outreach and education materials, and through partnerships. And so our asthma program is housed in the Indoor Environments Division in the Office of Air and Radiation. And so while we're working regulatory through regulation on outdoor air quality through indoor, in the indoor environment, we work voluntarily to ensure that environmental controls are incorporated into comprehensive asthma care. And we do this through partnerships and working with healthcare industry, with housing, with schools, and other community programs. The next slide. The work we do with these organizations is grounded in science, and science informs policy and forms the foundation of our program approaches. So when it comes to the role of the environment in asthma, science tells us that with medical management and comprehensive care includes environmental control. And strong evidence and national guidelines recognize the role of environmental triggers and the importance of their remediation. And so we know that eliminating common triggers like tobacco smoke, pet dander, mold, cockroaches, and dust mites results in decreased symptoms and asthma episodes and improved health outcomes for people with asthma. So that's been well established over the years and through science. More recently, science tells us that home visits are a critical component that we need to address, particularly for at-risk populations. So these families are often in crisis, dealing with lots of issues, social issues and others. And so managing the environment is often a real challenge. You can go to the next slide. So the evidence supporting the role of the environment in home visits has been established, and providers and organizations like GHHI who are doing this work are seeing benefits from addressing the environment, and there are best practices and examples of translating evidence-based practice and policies into evidence-based into policies, and now the work is to spread those best practices. So we've been working for the last several years to expand care, as I said, outside the clinical setting by systematically integrating in-home interventions into the healthcare system. And now the next big challenge is getting these services covered through sustainable financing. We're doing this in a variety of ways. You can go to the next slide. The work that we're doing to expand access to in-home interventions and home visits is a coordinated effort with federal partners from CDC, HUD, and NIH through the Asthma Disparities Action Plan. And EPA's role as a member and a lead on the Disparities Action Plan is to really focus on community programs and how we can, again, ensure that environmental management through home visits is a part of comprehensive care and is sustained. So in addition to our federal partners, EPA has partnered, again, across health, housing, and environmental sectors, and we're working hard to identify best practices to successful programs, and then support the spread of those best practices in a variety of ways through local and regional summits, through working with state organizations, and through organizations like GHHI. We've been proud and happy to support technical assistance for the last 2 years, and as I said, going into the third year, through the cooperative agreement to programs across the country to help them advance their work and provide, again, technical assistance towards ultimately reimbursement. So on behalf of EPA, I'm pleased that you're interested in learning more about GHHI's National Initiative for Asthma Reimbursement. I'm pleased you're here with us today, and I'm also available for questions. If you have questions about what EPA is doing or how we can support you, we support an online network, asthmacommunitynetwork.org, and hopefully many of you are members. There are many resources on that website, and a great way to interact with other programs across the country doing similar work. So thanks again for your attention, and with that, I'll turn it over to Brendan.
All right, and thank you, Ruth Ann, and thank you, Tracy. That was a great overview of the vision of our organization and the EPA mission, how they overlap. Let me quickly give an overview of the National Initiative for Asthma Reimbursement. Essentially, we had 3 goals. The first one was to, increase the number of home visiting programs that are providing environmental health services. And so this goal aligns with our business development technical assistance. The second goal was to increase the number of health plans that serve the Medicaid populations and/or Medicaid programs that are reimbursing for these comprehensive asthma services. And that was goal is aligned with our reimbursement support technical assistance services. And the third goal was, one of the gaps that we found is that there's been a lack of use of standardized environmental management and health outcomes when doing evaluations. And so we had a work group and have spent some time doing some research and developing a publication. And on September 4th, we'll have another webinar presenting those findings and the recommendations from that work group on those metrics. That was the third goal. All right. And you see here, these are the three activities that we're performing to meet those goals. And the reason we're doing it, as kind of was already said by both Ruth Ann and Tracy, is that we know that there's guidelines-based care. There's multiple components of the care, which we, displayed here: medications, assessment, monitoring, patient education, and control of environmental factors. And even though this is guidelines-based care, a lot of these, especially the home visiting components, are not covered by health plans or insurance, even though this might benefit, their populations the most. So we are delivering these, technical assistance for the last 3 years, and this is the third year, or last 2 years, and going into the third year, to try to change the system and how it operates, does business. Also, to help us with some of the more difficult policy issues in states, we have our partners at the Center for Healthcare Strategies. Specifically, Diana Crumley has been assisting us with some of the reimbursement support sites, and we look forward to having them help us again in this third year here. Okay. And then now I'm going to go real quickly over the business development technical assistance services. The goal is to increase the number of asthma home visiting programs. The eligibility criteria is to have 2 willing partners, one a healthcare entity, one a service provider, both willing to provide letters of commitment, and that they both also have an interest in delivering environmental health services as part of their asthma home visiting program. So this is for the business developments for those programs that might be existent and need help developing a business plan or engaging healthcare payers or the state Medicaid programs. Or you might be just starting a pilot or planning, how to develop an asthma home visiting program. So this one's really for all entry levels. Last year we accepted 6, and this year we will be accepting 2 business development sites, and the site cohort will run from January 15th to February 1st of 2020. That's when we'll be accepting the application. Sorry about that. The RFP we have already released on August 1st. I'll have to correct that slide here. But the proposals for the business development will be due November 18th. So there's a couple months before that's due. We also will then announce the public award on January 31st. And you can see in 2018 we had 4 sites that were awarded, and this year we've been working with 6 sites. And this, for the last year, we'll be doing 2 sites. Okay. And as far as just a quick brief overview, for business development, we do have a series of 8 technical assistance services that we deliver. You can see here it ranges from project planning through data management, through operation planning, all the way to developing a business plan at the end by September of next year. And you can see that these technical assistances, we basically cover all of these deliverables on the right-hand side in the business plan as we work together over the 8.5 months. And just to give I said this is on a fixed time schedule for the business development cohort. And you can kind of see, it's flexible and it depends where sites are, but this gives a general idea of when we would cover the different technical assistance services. So we start off with basic project planning, engaging stakeholders. This starts with internal partners and external partners, and all the way on through to having a business plan by the end of September. And you can see we generally have about 3 site visits where the site lead from Green and Healthy Homes Initiative goes in person. All right. And next, I want to kind of let y'all know from current participants in our technical assistance service, we have a couple sites that we'd like to highlight from the year 2 cohort. First, we're going to start with Kara Hausler from the City of San Antonio Metropolitan Health District. So welcome, Kara.
Hi, this is Kara Hausler, as Brendan said, with the City of San Antonio Metropolitan Health District. And we started we're really excited to have partnered with Green and Healthy Homes. It was very optimal timing for us as we had just received some funding to launch a new program addressing pediatric uncontrolled asthma in children here in San Antonio, where we have of all the large cities, some of the highest hospitalization rates for asthma. So our program got funded in January, and the Green and Healthy Home support started in January. So that's what I'm saying. It was very perfect timing for us. So we had a lot of experts locally that had helped get us the funding and create a vision, but the Green and Healthy Homes team really added a tremendous amount to that, bringing knowledge from the other programs across the nation that has really augmented our operational planning, developing our processes, learning about, well, how does another city do it? Protocols, connecting us, helping us connect with payers, and providing us some tools to help get the contractual relationships established. Also plans on helping us with plans on data management and tools for us to use as we continue to build our program evaluation of how we're doing. So when we started with the in-depth stakeholder analysis, looked at who we knew and who we needed to reach out to, wasn't already in our fold, and also mapped out the process flow diagram, as well as writing a narrative for our staff to help them all be on the same page. Of course, those are living documents that get changed as we learn new things as we're implementing this, and as we learn from other partners around the nation. The data agreements we talked about, they're still in progress, but Green and Healthy Homes helped us get that started. We have, with government contracting, sometimes can take a while. And I'm with the city government. We're finalizing our data management and evaluation guide at this time, and we'll be at the end looking at pretty soon the cost-benefit analysis. So I just can't speak highly enough of this program and how much they've helped us navigate this startup phase, and it's just been very beneficial to all of us here.
Well, great. And thank you, Kara. Thanks for coming today and telling everyone about your experience.
Yeah.
And next, let me go to the next slide. We also had another business development site in Contra Costa County, California, and we'll have Will Klein, who's the site lead from Green and Healthy Homes Initiative, give a brief overview of the progress they've made there. Will?
Yeah, can you hear me? Can you hear me, Brendan?
Yes, we can. Perfect.
Great. So Contra Costa, they're similar. I mean, their goals are really to kind of build out an asthma program. I think what's unique with them is a couple things. One, they'd already piloted asthma home visiting services through their health plan, which is run by the county itself for Medicaid. And then also, as part of that pilot, they've also been piloting out referrals from that pilot with their weatherization partners that are also housed within the county. And so the goal here was really to kind of, how do you formally build this program out and scale it and partner with another program, which is MCE, which is a renewable electricity provider in the region that has an energy efficiency program. And then the business case really kind of, what is the value of this program to the county and to the members of the county? And so kind of just highlight one aspect of this that we worked on is we got data from the health plan and looked at census data to kind of estimate a couple of things. So Brendan, can you go to the next slide? So the first thing we did on the data side is really, the question is, of the people who are eligible for the program, we looked at, people with asthma who had been to the ED in Contra Costa County, and how many of them were eligible for Medicaid, how many of them were eligible for weatherization programs. They also have another energy efficiency program through BayRen, which doesn't formally, but kind of has some sort of target that they'd like to, allocate as many resources as possible, kind of the folks who make too much to qualify for weatherization and income eligible programs, but still could use support in doing energy efficiency upgrades to their home or multifamily building. And so this was kind of an analysis with census data where you see that, only, Medicaid maybe is 18% of the population, but 24% of the people with asthma. So you have a higher percentage of people with asthma on Medicaid. And then you also see the overlap where not everyone on weatherization that qualifies for weatherization qualifies for Medicaid, and not everyone who has Medicaid qualifies for weatherization. And Medicaid are the people in the green dots, and then gray are the people who are not on Medicaid. And then you have the first section there is people who make under 200% of the federal poverty limit in their household. Then you have kind of the middle income and then the higher income. And then you can also map that out geographically to find out which regions of a county you would want to target with the program who have the highest need. And then the next slide. And then, so the other thing you can do, so that's just kind of saying, okay, if we want to serve a program that targets Medicaid and weatherization, we're going to reach maybe 10 or 15% of the county, of people with asthma in the county. The other part of this is saying, if we serve people on Medicaid, what would the savings be to the health plan? So, when GHHI started this work, and this may have been said, realized a lot of the payment for the avoidable hospitalizations that are a result of asthma are paid by Medicaid. And so we take the health plan data, work with the health plan, get the data from them. We have the in-house expertise to kind of structure what the data request should be, and then process the data and turn it into a kind of economic model to project savings. And so you see here, I've taken off the actual dollar amounts for privacy reasons or kind of confidentiality reasons. But you can see basically the type of thing we would do is you would get data from the health plan, estimate their cost. That black line at the top would be the estimated cost that if no one got any asthma services, and that's based on data GHHI has collected from 10 plus insurance companies around the country, several states. And so we have an in-house repository, reference class of data that we can use to kind of qualify and kind of check your own locality's data against, or fill in any gaps that are missing. For example, Contra Costa, we only pulled 1 year of data, but we could estimate what the trend line would be in the next few years based on our reference class. And then from all of our experience working with asthma programs around the country over the many years, and our own research work that Brennan leads in Baltimore, we have really good estimates of what a potential impact of the program would be on Medicaid. And so that's what that dark green line is. And the dotted green line are just like a conservative and optimistic estimate of what savings could be to the health plan, or what those are showing is what the cost would be after you do the intervention, and the delta between the black line and the green lines would be the savings. And so the graph on the right just maps out what the savings would be. And you can see it takes a couple years to accrue enough savings to kind of pay for the upfront investment. And so that red line would be, we would then do a budget exercise with you, estimate what the cost of the program would be, and then basically use that to say, here's when we think the ROI would be and how long it would take to pay back this program. That's that.
Great. And that's thank you, Will. for the presentation. That's a great example of, a lot of the work we're doing trying to get, weatherization, energy efficiency programs, and health partners together to collaborate and make these asthma home visiting programs possible. So, and we do have a couple other participants from this year's reimbursement support. But first, I'm going to go quickly over the request for proposal here. For the reimbursement technical assistance, the goal is to increase Medicaid funding. So the ultimate goal is for if anyone's looking to apply for this, is you and your partners are kind of already at the stage where you're at the same table and you agree that you want to pay for these services. You just don't know how. So to be eligible, you have to have an operational program, or at least about to go into piloting, or on the border, or you already just started piloting, but you need to have an operational that includes environmental health services as part of the operational plan. You also have to have an established partnership with a healthcare entity. And similar to the business development, this year, and just like last year, we require letters of commitment from both of those kind of primary partners. The difference, one difference in the reimbursement technical assistance from the business development, other than eligibility criteria, is that this provides 12 months of technical assistance, which begins generally when we have our kind of kickoff visit and sign the MOU to get the project started. This year, we did move up the release date of the RFPs, just like we did in the business development. So they were released on August 1st. There'll be proposals that are essentially accepted on a rolling basis. We'll start accepting the proposals on October 1st through February 1st. And this year, we are looking for actually 5 sites. So 4 sites. I'll have to correct that too. But we have in the past, and in the first year, we had 2 sites. We had Integra from Rhode Island, as well as Healthy Homes Des Moines, great partners. And then this year, we've been working with 3 sites, UPMC Health Plan, you'll hear from next, as well as John R. Oshide Children's Hospital up in Buffalo, New York, which you'll also hear from today, as well as some really great partners, LISC NYC down in New York City. If there's any questions on this, I'll let everyone know. You can put it in the chat, or for business development or reimbursement support, you can email me and we can set up more time to answer questions. So what kind of technical assistance do we provide? We can provide any of the technical assistance we provide to the business development sites, but we tend to focus a little bit more on policy analysis, ensuring whatever kind of payment model support, that the payment model is supported by the state Medicaid. So if you already have agreed with your payer and your service providers on what the payment model might be, you still might need to make sure that this is going to work in your state. We also provide a lot of data support, whether it be around creation of execution of business, data use agreements or business associates agreements, as well as assistance with institutional review board applications when deemed necessary. And as kind of Will's example showed, we do a lot of economic analysis. Sometimes we can do this in-house. We also work with the actuarial and financial teams of partners all the time, and always willing to collaborate and just make sure. I'll say for the reimbursement support, the main difference is this one is meant to be more customizable, whereas when you're filling out your application, you should be letting us know that you think this is the pathway towards reimbursement that you want to explore, and how you plan on going about it and how we can support you in that endeavor. And moving to one of our partners in this year's reimbursement support cohort, I'd like to introduce Joan Eichner with UPMC Health Plan. Joan?
Hi, good afternoon, everybody. This is Joan Eichner. I'm with the UPMC Health Plan, and we are a large integrated payer-provider system located in Allegheny County, Pennsylvania. That's where Pittsburgh is. And I work on the insurance side of that partnership. So our project is kind of a hybrid business reimbursement project. We are working with our county health department, ACHD, to basically combine existing resources from both of our agencies to create a new collaborative model and then identify ways to reimburse for it. So this is building on a longer-term partnership that the health plan has had with our County Department of Human Services. They have a state grant to provide the Safe and Healthy Homes program where they go in and do home-based assessments for a number of environmental triggers, including asthma, lead, fall risks, child safety hazards, and those kinds of things. But that's a grant-funded program, and they're somewhat limited in what they're able to do, and there's a finite amount of money available there. From the health plan side, we know that we have a high rate of pediatric asthma in our communities, particularly in lower-income families and African-American families. And so one of our goals is to really identify lower income families at the time of an inpatient hospitalization related to asthma and to make a referral to the Safe and Healthy Homes program, and then to evaluate these outcomes and be able to create a strong business case for the health plan to reimburse the health department for this program. So the target population that we're working with specifically is folks up to 300% federal poverty level, and it's children birth to age 22 in those families at the point of time where they're being discharged from an asthma-related inpatient hospital stay in one of the UPMC hospitals in Allegheny County. So what we've worked on to date is mapping out a process flow from the point where we identify members who are eligible to the program and make a referral, and I will explain this more in detail on the next slide. We make that referral to the health department's program as well as our existing asthma care management team, which is essentially a nurse that is specialized in working with pediatric asthma patients, and she provides mostly telephonic support to them after an acute asthma incident. Also in progress, we have created a BAA, which will allow us to share data and information between the health plan and the county health department so that we are able to share protected health information on our members back and forth between our entities for the purposes of this program. And we've also pooled together some baseline cost and utilization data for the members that are eligible for the program, which will allow us to work on the evaluation. If you could move to the next slide, please. Thank you. Okay, so this looks super complicated. It's really not as bad as it seems. This is the referral process that we have, and I will walk you through it. So our Children's Hospital Transition Coordinator, which is a position that's funded by the health plan, she identifies members that are eligible at the time of their discharge for the asthma incident, and she speaks with them about the program, about the Safe and Healthy Homes program, and asks if they're interested. Ideally, we're having this conversation in person at the time of discharge, and then they do a warm handoff where they call together the Safe and Healthy Homes program, and that family is enrolled in the program if they wish. If that's not possible, we're also able to get the members' consent to call or email and share their information with the health department's program. We then, as I mentioned, enroll them in our asthma case management program so that regardless of what their experience is with the Safe and Healthy Homes in-home assessment, they will also get this ongoing care management support for their asthma needs. So the county will receive our referral either via warm handoff or some other form of referral, and they essentially outreach directly to the family, and they confirm eligibility and that the family would like to receive the in-home assessment, and then they schedule the home visit. They take an inspector and an educator into the home, and they do a thorough home assessment, as I mentioned, not just for asthma triggers, but for other things. They provide supplies specific to what they see the need in the home. So those can be, mattress covers, HEPA filters, various things depending on what the needs are. And then they provide a bit of education at that point to help the family identify and reduce some of the environmental risks in their home. So the Safe and Healthy Homes program does that assessment. They provide a written report to the family as well as the landlord if there are issues that a landlord needs to address as far as the upkeep of the home. And then we receive a copy of that. The family receives a copy of that report, and then the health department does a follow-up assessment with the family 45 days later. They, of course, can continue their participation in the pediatric care management programs through the health plan. So we'll be evaluating this as far as interest in the program and cost and utilization data that we have through claims here at the health plan side. And we'll also be looking at doing some sort of quality of life assessment on the folks that participate to see if they have an increase in quality of life based on this program. So that's it in a nutshell.
All right, and thank you, Jen. That was great. I just want to explain one thing. If you see the first slide, why it said Business Development Reimbursement Support. Last year they actually, applied as the business development, but they had such a quality application that we thought that they were better applicable for reimbursement. But we still kind of developed a project plan to go through those same business development technical services, which was what they had requested. So, but they've been a great partner, and I'm gonna. So thank you again, Joan. And I'm going to move to the next slide and go to Kate Belsey, who's will be representing GHHI Children's Hospital from Buffalo, New York. Kate?
Good afternoon, everyone. GHHI Children's Hospital's project goals, we're looking to improve the health of vulnerable children in Buffalo and Erie County, specifically related to asthma and other environmental health issues concerning the community. We have an extremely high incidence of pediatric asthma in this area. We're looking to bring in managed care organizations who have a large population of the Medicaid population to engage them into the project. And we're conducting a pilot test to test the budgetary assumptions and operational processes developed for home asthma interventions in the PFP feasibility study. We're looking to leverage the New York State Medicaid program partnership with the Office of Health Insurance, OHIP, that has dedicated an entire bureau to focus on social determinants of health. The Bureau of Social Determinants of Health plans to work with health plans, providers, community-based organizations, performing provider systems, and value-based contractors on initiatives to improve State Department of Health and health outcomes with our most vulnerable populations. Next slide. Our pilot project plan, we're going to provide asthma education and in-home remediation to households with asthma, test the strength of the partnerships and reduce hospitalizations and ED visits for children with asthma, and to determine operational efficiency and average intervention expenses, in addition to children's health outcomes, medical usage, and resulting savings from this model. We're looking to have a direct impact on at least 10 families in the Erie County area. Okay. Our project partners, GHHI Children's Hospital would be the lead. Partner 2 is our independent health Medicaid payer, which is a large managed care organization in our area with a very large Medicaid population. Buffalo Prenatal and Perinatal Network service provider entity. They will be doing the home visits, delivering services addressing the social determinants of health, providing families with asthma education. They'll conduct assessments for home-based triggers. They'll make referrals for home health interventions to GHHI, Buffalo Nonprofit Housing Partners, and they'll maintain and track records of services provided for program enrollees. We're also partnered with Millennium Collaborative Care, that is our local DIS rep, and they will serve as a conveyor and data collection point for the project, community-based organization leadership and management, and they'll administer grant-like funds as appropriate. And then we also have Community Foundation for Greater Buffalo and GHHI Buffalo will provide the actual home interventions such as carpet removal, pest management, and moisture remediation. So long term, we're looking for, okay.
Okay, continue. Are you done?
Yeah, I'm done.
Okay, great. Well, thank you so much. And I'll just say I'm also the site lead for that project, and so it's been a great partnership. We've had about 3 site visits, or we're about a little bit near halfway through the project, and they'll be launching the pilot this August here, and so we look forward to see where that project goes. And for the next part, we're going to just have a quick review of the application components, and before we do that, I want to thank all the panelists for joining us and sharing their perspective. Next, I'm going to turn it over to Mike McKnight, our VP of Policy and Innovation, and he'll just quickly review some components from the application, and we'll see if there's any questions. Again, if we don't get to the questions, we will make sure they're answered and distributed, and we will, on the website, we keep a frequently asked questions list throughout the application time.
Great.
So,
thanks,
Mike?
Brendan. Thanks. Yeah, so I'll try to be brief. So for the business development, it really is for programs that are looking to establish or strengthen asthma home visiting programs and include an environmental component. So that's sort of what that track is really looking to do. It's more around the sort of capacity building, and a requirement is to have sort of like a healthcare entity partner, as well as a partner that's delivering the program, and having to have letters of commitment from each agency, basically committing to the fact that you're going to spend 9 months working on developing or strengthening those programs and that relationship. Now for the reimbursement track, sort of these are for more of the established programs that have been up and running, that really just trying to sort of focus on the how of getting reimbursed. So similar requirements to the business development, but in the letter of commitment, there really has to be from that healthcare entity in terms of like mainly the payer that would essentially be the entity that would be reimbursing at the end of this process, to basically commit to, not that they'll actually 100% commit to reimbursement, but at least that the payer is committing to working on a reimbursement model. And so those are sort of the requirements. And as you heard from UPMC earlier, if you have questions around sort of which bucket I fit into, or I sort of fit into both, we'd be happy to have that conversation, and sort of we're able to sort of be flexible and provide guidance on that. Next slide. So in terms of just the general requirements for this EPA-supported grant, there will be an MOU between GHHI and our awardees, sort of mapping out what technical assistance services we're going to be providing, and we want to make sure that our partners understand that because it is a federal award, and so for things that aren't confidential, they may be asked to be part of sort of general knowledge sharing to help the field. EPA has great sort of websites and other vehicles to disseminate sort of best practices, and so you'd be looking to be participating in that as well. For the estimated time for our partners, for the business development side, thinking about in total, and that includes sort of all the people that might be involved in the project, around 240 to 360 hours over the course of sort of those 9 months, various aspects of program delivery, looking at the costs, budgeting, those sort of things. And for the reimbursement, which, as Brendan was saying earlier, is more tailored to what the project really needs, but in general, we want to ballpark around 20 to 30 hours per month for each partner. So if we're talking about if it was like a health plan and a clinic that was delivering the asthma program, 20 to 30 hours from each partner. Next slide. In terms of general materials, I'm looking for cover sheet, proposal narrative. This is all mapped out in the RFP, the most recent financials, and then those letters of commitment. But I want to make sure to highlight that anyone that's interested in potentially applying, we do 30-minute calls with each potential applicant where you're free to ask all of your questions. Do encourage that. To have that conversation. And as Brendan said, for things that are applicable across all of our applicants, we do sort of post an FAQ document up on the website, and we keep that updated if there are sort of questions that we feel like the broader pool of potential applicants needs to see. Next slide. So all of the materials can be found on our website. If you look at we got November 18th is the due date for our business development applications, and the reimbursement proposals is a rolling review, basically starting October 1st. And we'll be making public announcements by the end of January. I think we can now open it up for a couple minutes of questions.
Yeah, thanks, Mike. Annie, I'm looking, do we have any questions? I don't see any in the chat.
There was one question. If folks are already or have applied are applying for the reimbursement grant after receiving the technical assistance grant, do they need additional updated letters of support from partners? Yeah,
they would be new letters of commitment. Yeah, for the request for proposal. So if they had gone through, I think if I understand the question, they had gone through the business development, technical assistance services, and they were interested in applying for reimbursement support, would they have to have new letters of commitment? And the answer is yes. And we want them the way it's said or stated in the request for proposals. We have a rubric for scoring the reimbursement support applications that the external reviewers use, but these letters of commitment, kind of would go into helping us make determination of, the capacity and the qualification to the project, commitment to the project. So yes, they would have to have new letters of commitment for the second proposal. And did we have any other questions, Annie?
We have a couple more questions. Another question from Lauren. What is an A133 audit?
Mike, do you want to answer that one?
Sorry, I was on mute. So we did say that it's as applicable, basically. So for folks that are like regular federal awardees, there's like an audit that organizations and entities sort of do on an annual basis. So you can probably just sort of kind of check with your financial team. But it's basically if it's applicable to your organization. So like if you do produce A133 audits, then we'd be looking for the most recent one. If not, then it's just not applicable.
Great. And it looks like that's all we have for questions in the chat here.
And yeah, for we have an electronic submission, so it's not some of those A133s can be very large documents. We're not asking anyone to print it out and send it in. We'd even accept like if you have like a link to your A133. Some organizations have that. That would be acceptable. I will say I want to thank everyone, since we want to keep on time, for attending today, and thank again to all our panelists, to our executive leaders, Ruth Ann Norton and Tracy Mitchell. We will put the questions that we went over up on the website with the frequently asked questions. And again, if you have any interest or questions, just contact us and we can set up a 30-minute call. Again, thank you all for attending today.